Thank you for tuning in to hear about MediShout. My name is Ash. I'm an orthopedic surgeon by trade, and I founded MediShout 8 years ago. This is our core team. Our vision is to transform healthcare buildings into digitally smart environments so staff can deliver the best patient care. So what is the actual problem? Well, I'm a surgeon, and 2 years ago, I had to cancel 3 operations one morning because a light bulb in theatre was broken. And what's worse is clinicians get delayed every day by similar operational problems, such as broken IT, not having their passwords, not having stock or equipment they need. And the impact is massive. And I'll tell you about 3 studies. The first one is that the Journal of Nursing Times reported a third of NHS nurses are wasting up to 2 hours per shift just looking for missing kit. International studies have shown clinicians are only spending a third of their time with patients. And a really big one was a year ago. A study showed that there's been a 32% increase in cancelled NHS operations because of problems such as faulty equipment. And this is actually before COVID. MediShout is a solution. We provide a one-stop shop for solving all operational problems and for digitizing services. So we solve this huge problem 3 main ways. First of all, the MediShout app is the first in healthcare for staff to report any operational problem straight away. It could be IT, stock, estates and facilities, PPE. The workflow is really straightforward. If you're working in a hospital, a GP or a care home, you report your problem, we send it to the relevant party, whether that's a help desk, the relevant manager, or directly to equipment suppliers and manufacturers. And the data aspect is then really massive. So every time you report a problem with MediShout, it will ask you what happened, what was the impact on patient care and patient safety, and then whatever comes up as high impact, hospitals can resolve those first. We're also able to use AI to predict problems before they happen. So this is an example of where we predicted when an ECG machine was going to break down. We've also predicted when your ventilators might break. We have exciting product launches coming up. We're using QR codes and placing them on hand sanitizer pumps. So when the hand sanitizer runs out, anyone with a smartphone can just scan the QR code and it sends a message to estates and facilities. So that can be patients, visitors, and staff. In terms of benefits, we've been shown to save NHS trusts £1 million a year in efficiency savings. We saved time for staff. At Imperial College, we improved PPE allocation during COVID, and we published that data. And at MSc NHS Trust, we're helping them perform their staff COVID risk assessments and have done almost 1,000 in 2 months. Key NHS targets we hit include going paperless, have a long-term plan with regards to workforce, digitization, and improving efficiencies. We're really glad to be on the NIA and really appreciate their support and the NHS Entrepreneur Programme. We've had funding from Rise Asset Management and Innovate UK. We've published our data in lots of journals, and we're very happy to send any of those to you if you want to know any more information about us. Please get in contact with us, and we're always keen to see if we can solve challenges for other NHS trusts. Thank you very much.